Welcome back to Fox 51 today. The government has made some changes to the way we get our prescriptions renewed, and some pain medicines have even been reclassified. We've got Dr. Shawn Dunn. He's a director of Trinity Mother Frances Health Center, Neuroscience Institute, and he's going to answer some of those questions for us this morning. Okay, Dr. Dunn, tell us about some of the prescriptions that have been affected by these government changes and, how this is affecting the way East Texans can get their prescriptions refilled.
Certainly. Thank you for having me here today.
Thank you for coming by.
As of October 6th this past year, the DEA actually has reclassified certain pain medications, and these are primarily those that contain hydrocodone preparation.
So how does it make getting your refills, picking up your refills any different? Do you have to go to the doctor and maybe get another prescription, or how does it all work?
Right. Before, we used to be able to call in certain medications, such as Norco, which contain hydrocodone. We could also fax those in. However, now the patient actually has to come in the office and either pick up the prescription and see the physician to get those medications. So it does make it a little bit more difficult for the patients.
Okay.
So what would have been the reasoning behind this? I probably think of some good reasons for it, because there tends to be, I'm sure in some circles, some abuse of these, right?
Certainly. Really, since 1999, there's been about a threefold increase in the number of prescription overdose and deaths. In fact, in 2008, there were over 36,000 prescription deaths and drug overdose related deaths, and most of those were related to over-the-counter or prescription medications.
Now, has Trinity Mother Frances, have you guys been doing anything differently to handle these government changes?
We have. We made some changes internally in our clinic, but also we're excited that with our Connect Care EMR system, we're going to be one of the first systems in really the region to be able to do EPCS, which is electronic prescription of controlled substances. So when a patient comes in to see us, if they are a candidate or require opioids, we'll be able to call those in electronically or send those electronically to their pharmacy.
So make it more convenient, I'm guessing?
That's correct.
Okay.
Wow. So going forward, I guess obviously you see this, will there be other changes you think? Are there other ones in general to the pharmaceutical industry in terms of how this is related to what we've been talking about this morning?
There have been changes both on a state as well as the federal level with some of the programs, some of the access that we have in monitoring these medications for the patients to ensure that the patient does get the medication they need and is prescribed safely. Those are ongoing, and we're going to continue to look at those.
Now, are there any other things that you guys do over there at Trinity Mother Frances to make getting your prescription more convenient for patients out there?
We try to have the access for the patient to be able to come in and see the physician or the mid-level in a timely manner so that they can get evaluated, and if they do need the medication, get those in a timely manner.
All right.
I've noticed with some medications, not necessarily obviously pain, because I'm sure that's a different animal, but some you notice through time become over-the-counter. Probably not so much with your pain medicines. Is that something that is pretty typical? I mean, I don't know, maybe I'm thinking of antihistamines, of course. Every now and then things show up. At what point if it's any type of a medication, does it qualify all of a sudden it's magically an over-the-counter? I've often wondered that. That's
an ongoing process. Actually, the FDA looks at all medications and they continually review those to see if they are applicable for perhaps over-the-counter. As with the hydrocodone medications, the FDA looked probably about the last year or two in changing that, made the recommendation, which led to the DEA recommendation and reclassification of that medication.
Well, that's some very interesting information. Thank you so much for stopping by this morning and telling us all about this.
Thank you for having me.
Thank you.
All right, coming up.